Hello, today we'll look at unipolar depression and its statistics. Epidemiology is a fancy name for statistics, actually. So, which disease is the second leading cause of disability in this world? What do you think? This answer will be kind of obvious because we're dealing with unipolar depression. The title itself is unipolar depression, and that's the second leading cause of disability in the world. Mark the word disability, because disability is not the same as mortality. When we are dealing with disability and mortality, that meaning the death of a patient, so a patient dies, then it's the 11th greatest cause, and that's high also. So 11th greatest cause of somebody having a disability and dying, or the second most common cause of somebody having a disability in the world. And that's very, very high. Okay? So this is not a rare disease. How many patients with unipolar depression do you think is not even recognized by their doctor? So patient comes in, what is the risk of him not being recognized by the doctor having unipolar depression? Half of them. Is this scary or not? That means that the patients that are going to the doctor, half of them are not even recognized having depression. The doctors are not trained good enough for recognizing depression, or they just simply don't have time enough to go through the necessary questions required for diagnosing a patient with depression. Now, let's look at something else. About how many percent of patients diagnosed with depression by a primary care physician, so your family doctor, is false. So that's the opposite. That's the flip coin of it. A doctor will tell you that you have depression. What is the risk of him being wrong? 20%. So this doctor now, family doctor, will tell, let's say, 5 patients that they have depression. 1 out of these 5 will be wrong. The diagnosis will be totally wrong. It's not depression. So in one end, we have doctors not recognizing the disease, and the other hand, we have doctors giving a false diagnosis, meaning they say that you have depression, but you don't have it actually, in 20% of cases. So that's very, very sad also. Okay, so we need to train doctors in recognizing depression, and therefore I really try my best to make videos that are understandable for everybody, not just for doctors, for everybody, so that you also can recognize it on yourself. You don't need a doctor all the time. You need self-awareness. You need to recognize the symptoms of yourself, and then you need to go to the doctor and ask if this can be the case, because you have much more time to learn about yourself than the doctor have in 5 minutes. The doctor will see you in 5-10 minutes. He don't have the chance to know you so good as you yourself. You have time, you have many hours, you have many days, you have many weeks to answer yourself these questions that I'm asking you. So please look at the videos and then go through them on yourself. What is the definition of a recovery of unipolar depression? Recovery means that we have at least 2 months of period with no more than 2 symptoms of depression. And look at the video explaining the symptoms, and then you will understand what type of symptoms exist for depression. And you should have no more than 2 of these symptoms for at least 2 months. If you have 3, 4, 5, 6, 7, 8, I don't know, then it's not a recovery. A recovery is that we have almost 0 symptoms, but we can have this threshold of 2 symptoms without any impairment. Meaning psychosocial functioning impairment means you can function in your society, in your group of friends, in your workplace. It's no problem with the functioning. You have these 2 symptoms, but it is not causing you any harm. So more than 2 months with 2 symptoms maximum. That's a recovery. That's good. How long does it take on average to recover from a depression? 20 weeks. So you have to have some patience. Okay? You got this depression in February. It took you 20 weeks. It can take you 5 weeks, but on average, actually, it can take you 20 weeks, and it can take you maybe 40 weeks also. But on average, it will take you 20 weeks. So you need to have patience. It is not a really quick fix. You cannot fix this disease in 1 week, because the underlying subconscious mind, the underlying problems that you may have as a person in your society are maybe so strong, so hard to grasp, or so hard to treat. You maybe have many traumas in your life. You may have thousands or millions of problems that have accumulated, and therefore, please don't expect a doctor to give you a pill and then everything is fine. You need to work with a doctor to take this pill, not just 1 week, several weeks. You need to go to psychotherapists. You need to talk with psychologists. You need to exercise. You need to lose weight. I know it sounds confusing, but all these things add up. If you exercise, you feel better. If you eat healthy, you feel better. If you do talk with psychotherapists, that will make you behave better, and that will make you function cognitively better. You will feel better about yourself if you can talk about your problems. Talk with your friends, talk with your family members, and it will require from you patience. How many patients have a recurrence of depression during a 20-year period? So you have depression now. It will take you 20 weeks in average for you to recover. And then you recovered, and then you think for yourself, okay, that was it. That was not it. During a 20-year period, it will have a group of 50% of people getting it again. Maybe you're lucky, you will not get any depression anymore, but 50% chance of you getting a depression in 20 years of time. A recurrence of this depression. So that means patience again. Work on yourself, patience. What is the prevalence of unipolar depression? 20%. That means if you take a group of people, how many percent will have depression in your population? 20%. 1 out of 5. It's no wonder that we're talking about the second leading cause of disability in this world, or the 11th leading cause of disability and mortality in this world. 20% of the population having depression. This is not a rare disease. Prevalence of persistent depressive disorder. This is something else. This is when you have a depressive mood for more than 2 years. It's persistent. 3%. Okay? That's good, because otherwise it will be very sad if we said it's 20% also. So 20% for depression, unipolar depression, and 3% about persistent, that meaning more than 2 years. And that is high also. I will not say that it's not high, but it's not as high as normal depression. Which gender do you think is affected mostly? Females or males? Females, 2 times greater. Look at the picture, we have 2 females, so representing is 2 times more common in females than in males. Depression increase, do you think, or decrease with older age? What about older people? Do they have depression more or less than younger people? Actually less. That's interesting. Yes, older people are better suited against depression. Younger people, not so. Which are the risk factors for depression? Many of them. We have genetics, your genes, you cannot do anything about it. So I always skip this part. And actually this part is a very small percent, maybe 1 to 5% of the cases, genetics, okay? And low self-esteem. If you have low self-esteem, then that builds up and you will get the depression. Early onset anxiety disorder. Another disorder called anxiety disorder can lead to depression, early onset, meaning you get it in your early life. Substance abuse. Please stop drinking, stop smoking, stop cocaine, stop cannabis, stop all these things. That can all lead to depression. These are things that you can actually affect. People are always so focused on the genetics part. No, I have the genes, I have bad genes, and then they have this notion that because of their genes, they are supposed to have depression. No, but please, why are you drinking then? And why are you behaving like this? That is actually most of the cases caused by cocaine and cannabis and drugs and alcohols and so on. Genetics is some small part of it. Don't blame your genetics. Work on yourself. Have patience. Trauma during childhood. This is also something that is very hard to do anything against when you are a child. What you can do is when you have your own children, and watch out for them. Don't make them suffer. If you make your children suffer, if you have aggressiveness in your household, if you have a lot of alcohol, screaming, this is all trauma. With no love, the children will not feel any love. Then you have a lot of trauma during childhood, and then they will get depression. High risk factors for that. Stressful life events. Of course, somebody dies. Something happens with your job. Something happens with your marriage, and so on. Parental loss. You lose your parents. Lack of love from parents. This is very harsh for a child. Lack of love from parents. Divorce. The same thing. It's all related. Something related with your childhood. Trauma, divorce, lack of love, aggression. Relationship problems with your girlfriend, your boyfriend, you have problems. Yeah, this can lead to depression. And many young people who are in love, they are completely in love with this boyfriend. And now this boyfriend has found somebody else, another girl. And this girl is now completely devastated. She falls into a depressed mood. She has relationship problems. She falls into depressed mood. She has low self-confidence. She feels lack of love, and she can slip into a depression. And then people around her will tell her that, oh, but please, this is just your first love. Please don't be so sad. You will get over it. Then this girl will feel, okay, these people around me don't understand what I'm feeling right now. They just think I'm a young girl who was in love, and now I'm crying all the day like a whining girl. I'm weak. No. Young girls are actually killing themselves. And as we said, it's 2 times more common in females as in males. And as we said, it's not the older generation, it's the younger generation that are affected. So take this seriously. Take this seriously. Let this girl talk with the psychologist. Begin with that. Don't begin with medication directly, because maybe it's not really depression, but it can lead to depression. Therefore, let this girl talk with the psychologist. And not because this girl or some psychology freak, some psychologically freaky or something. No, she just needs to talk with somebody. And if you cannot do it as a parent, if the girl is not listening to you, then let a professional do it. Or please let the girl talk with psychotherapist or a psychiatrist. And not because she's psychiatrically ill. Okay? Low education. Yeah, this is sadly the case. When you don't have money, you have low education. When you have low education, actually the depression is higher. Okay? Low social support. People on the streets are getting easier this depression that we're talking about. But you will not recognize it because you will just walk by. You will walk on the street, you will see this guy on the street, and you will think, it's not my problem. He's depressed, he will maybe kill himself, but that's not your problem. This is very sad. Yeah, so low social support. Is it possible to have many subtypes at the same time? Yes, 30% you have a mix of things, many subtypes of depression. How many depressed patients do you think have another psychiatric disease? 2 out of 3. That's pretty high. And therefore I tell you, if a girl have a depression, let the girl talk with a professional. Because maybe we will find out that there are some other things hidden there that we didn't know. 2 out of 3 cases, we have another psychiatric disease hidden. How common is a personality disorders in depression? 50%. In 2/3 of cases, we have a hidden psychiatric disease. In 50%, we have a personality disorder. And we are dealing mostly with avoidant, borderline, dependent, and obsessive compulsive personality disorders. Please check this out on the other videos, or if you don't find it there, check out on the internet, Wikipedia or whatever. Avoidant type, these are patients that are actually socially a little bit avoidant. You probably had this type of girl or boy in your class, always avoidant. Borderline, then this is the opposite type. This is like an explosion on the other side. Therefore, I just pictured this. Very, very colorful, very, very, very manipulative, actually, in many cases. Lying many times, and very explosive, sexual attractive. These are just some things that just come up in my mind. But we will make a good presentation about this also. Borderline personality disorder. Dependent, always this clingy, this stalking time, dependent on somebody. This is a personality disorder that is most commonly related to depression. Very dependent. Cannot live with this other person. Obsessive compulsive. Everything has to be neatly structured. Very obsessive compulsive. This can also lead to depressive disorder. So these are the most common personality disorders that are common in depressive patients. And as we said, 50% have personality disorder and depression at the same time. How many depressed patients also have another medical disease? This is something else. This is a medical disease, 70%. Because they can have heart disease or blood pressure is high and so on. This is not so typical in younger people, but in older people, this is very typical, that 70% of cases have another medical disease next to it. How common is metabolic syndrome? When metabolic syndrome, having big belly, a lot of cholesterol, a lot of blood pressure, and so on. Metabolic syndrome, a lot of fat. 30% of people having this metabolic syndrome have then depression. Is this not interesting? We say that, okay, you should lose weight because you will decrease your heart attack risk and blood pressure and so on. But we never talk about the psychology of our mind. If you are obese, having a metabolic syndrome, you have a 30% chance, I would then tell from this statistic, of getting a depression. That's high. So we can work. Therefore, I say exercise. Also, exercise, eat healthy. You will reduce this then. So, quick review. Let's look at some things again. Second leading cause of disability in the world, we know, unipolar depression. 11th greatest cause of disability and mortality, unipolar depression. Unipolar depression is not even recognized by the doctor in 50% of cases. Not even recognized. In those who are recognized, 20% is false. The patient is having a false diagnosis. The definition of recovery is when we have at least 2 months with only 2 symptoms, maximum 2 symptoms, and we don't have any social functioning problem. 2 months with only 2 symptoms. How long does it take on average to recover? 20 weeks. Please have persistence, patience. It takes a long time. How many patients have recurrence of depression during a 20-year period? 50%. So in 20-year period, you can expect you getting this depression again in 50% of cases, and that's pretty high. What is the prevalence if you take the population? 20%. 20%. When we're talking about persistent depressive disorder, that is meaning more than 2 years, it's 3%. Still high, but it's not so high. Which gender is affected mostly? Females. 2 times more common in females. Does it increase or decrease with older age? Actually decrease. Older people have less depression than younger people. Which are risk factors? Genetics, low self-esteem, early onset anxiety disorder, substance abuse, trauma during childhood, stressful life events, parental loss, lack of love from parents, divorce, relationship problems, low education, and low social support. So genetics, low self-esteem, early onset anxiety disorder, substance abuse, trauma during childhood, stressful life events, parental loss, lack of love from parents, divorce, relationship problems, low education, and low social support. Is it possible to have many subtypes? Yes, 30% of depressed patients have many subtypes. 2/3 have another psychiatric disease. 50% have another personality disorder, that being avoidant, borderline, dependent, or obsessive compulsive. Avoidant, borderline, dependent, or obsessive compulsive. Another medical disease is present in 70% of cases. Metabolic syndrome, 30% correlation here, meaning metabolic syndrome is in 30% of depressed patients, and that was it. I thank you very much, and I hopefully gave a statistical report to you that was not so boring, because usually statistics are pretty boring. In this case, I think it's very interesting to look at the different statistics of depressed patients, because then you get a grasp of how important this disease is. So thank you very much for listening, and have a nice day. Bye-bye.